Hello, this is Dr. Gay from First Look MRI, and this is a 66-year-old female who had complaints of knee pain, leg pain. They did an x-ray and had seen that the x-ray here on the left did not look quite normal. There were some funny areas of relative low density and some brighter areas around the rim. Weren't sure what this was, so they did an MRI, and this is the MRI here. And we see that the MRI shows this area of abnormal low signal around the periphery, and then centrally it has more bright signal similar to the marrow. And this is the femur, this is the tibia, and now in the tibia are the same sort of a process, this serpiginous, sharply defined band of low signal on this with sort of fatty marrow in the middle and normal fatty marrow around the periphery. And this process does go into the medial-femoral condyle. And this is a classic case of osteonecrosis or avascular necrosis. And this is where the bone, the blood supply gets compromised and the bone will die here in the central medullary cavity and cause these big geographic regions of abnormal signal. She also had this really dark area here. This was some more active marrow edema, but this is just a case of osteonecrosis or avascular necrosis. And there's a number of things this can be associated with. It looks really striking and terrible. You think there may be a terrible tumor or bone infection, but again, this is just area where the bone has died because the blood supply is lacking for a number of any number of reasons. Now, a bunch of things can cause this. You can have sickle cell disease or lupus or radiation therapy, pancreatitis. Sometimes alcoholics can get this. One of the more common things is steroid use. If you're on chronic steroids, it can cause abnormal pressure in the bones, and the blood supply gets compromised, and you get big areas of osteonecrosis like this. Some chemotherapies can cause it. Old injuries or injuries where you have injured the blood supply can cause this. It would be unusual to have the above and below the knee, but that can happen in the hip sometimes or in the wrist. But in the knee like this, we think about mostly steroid therapy or other medicines, and also alcohol abuse. And so they're going to have to talk to the patient and find out if they have an underlying cause for this. This is a case of osteonecrosis. I'll put up another view here looking straight at it. You can see in this view, marrow is dark, and anything abnormal stands out as bright. Put up a side view here. And this is a side view, sagittal view. We can see that the normal marrow now is dark, and the abnormal marrow is bright here. So a case of osteonecrosis or avascular necrosis of the femur and the tibia of undetermined etiology at this time. Thank you very much.